Today we're covering dissected, and it's commonly removed organs and what to do if you've had them removed. So I wanted to do this workshop because over and over again in practice I see patients with gallbladders missing or appendixes missing, and I wanted to put together something to help these patients out once they have them removed, what they can do to help support their bodies after that. And then, of course, what to do to prevent it as well. All right, so here are the numbers. Every year in America, there are 280,000 appendectomies, the removal of the appendix, 600,000 gallbladder removals, 530,000 tonsil removals, 50,000 adenoid removals, and 72,300 thyroid removals. So all of these combined, I can't remember the number, but it's a lot. So they're not all organs, some are glands, some are patches of tissue, but they were there for a reason, and somehow along the way we started taking these things out. And it goes back to, I think I've covered it in every workshop, and Dr. Mike covers it a lot. It goes back to the medical model being very mechanistic, and if something's broken, let's just take it out. You don't need a gallbladder for life, let's just take it out if it's broken. But in reality, there are certain things that lead up to the gallbladder dysfunctioning that we should address those things first. And here we go. All right, so like I said, why are we as a culture having so many organs removed, and what can you do to support your body if you have had one of your organs removed? So we will go over tonight the function of each organ, gland, or tissue. So I really wanted to go over the function of all of these because it really helps to highlight the importance of having it in your body for the rest of your life. And we're going to go over what can go wrong with the organ, basically a differential diagnosis of the most common problems with that organ. Proper preventative care, so different things that you can do to support that in your body. Overall wellness, and so you had an organ removed, what now? There are some things that you can do to help your health. All right, so we'll start with the appendix. The appendix is this little thing right here that comes off of the intestine. It is it's kind of like a sac almost. It's hollow, and formerly they thought the appendix had no purpose. They call it a vestigial organ, and in humans today there is no purpose for it. But the more we learn about the human body, the more we learn that it does have a purpose. And the purpose of the appendix, as far as we can tell, it acts as a safe house for your gut flora. So say you have a bout of sickness, or you take antibiotics, or you have bad diarrhea, your appendix is basically hoarding a ton of good microflora. So everything gets swiped out of your intestines, it's going to function to replenish your good bacteria in your gut. So definitely very important, because we know that a good portion of our immune system resides in our gut. So one of the things that can go wrong with your appendix, the most common thing, is appendicitis. A lot of times this happens because something gets lodged right about here, and then it blocks it from emptying. So a lot of the inside of here secretes mucus. So if it can't get back out, it's going to get backed up, and bacteria is going to overgrow. And then this is when we have what's called appendicitis. It is, like I said, it's thought to result from the obstruction of the appendiceal lumen, typically by lymphoid hyperplasia, but occasionally by a fecalith, foreign body, or even worms. So basically, something gets trapped here and can't get out. And that obstruction leads to distension, bacterial overgrowth, ischemia, and inflammation. So it is just a little bit of the epidemiology. It's the most common between ages 5 and 40. The median age is 28. It tends to affect males more so than females and those in lower income groups. And for some unknown reason, those living in rural areas. So there are deaths due to appendicitis. Basically happens when the appendix ruptures and you can have all of that bacteria in your body. There are 72,000 deaths globally, but that's globally. I need to look up in America how many deaths are due to appendicitis. But in the United States, there were nearly 293,000 hospitalizations involving appendicitis in 2010. Appendicitis is one of the most frequent diagnoses for emergency department visits, resulting in hospitalization among children ages 5 through 17 in the United States. So it can even affect children. So, signs and symptoms of appendicitis. Has anybody ever had it? Okay. I've known people that had appendicitis and didn't end up having it removed. So you're going to have epigastric or peri-umbilical pain followed by brief nausea, vomiting, and anorexia. After a few hours, the pain will shift to the right lower quadrant. Pain increases with cough and motion. So the appendix is going to cause a pain in the right lower quadrant, which is right here. And you'll also have what's called rebound tenderness, usually, not in everybody. And rebound tenderness is basically when you press the abdomen, it doesn't hurt, but it hurts when you lift up. And then you'll have pain into that right lower quadrant. There's actually a test that you can do for it, and you press in the left lower quadrant, and it hurts in the right lower quadrant, and that's a sign of appendicitis. And that's rebound tenderness. That point right there that I mentioned that causes the painful is McBurney's point. All right. So, diagnosis of appendicitis. So here are the ways that if you go to the emergency room with these type of symptoms, they're going to try and diagnose you. They're going to do ultrasound, clinical exam, maybe a CT scan. But in my research, I learned that surgery is usually done before appendicitis is even confirmed. Because of the risk factors of death or anything dangerous, they usually will just go ahead and take your appendix out if you present with the symptoms that they think is appendicitis, which is unfortunate because the ultrasound does not take that long. All right, so typically treatment is going to be antibiotics and or immediate appendectomy. So they will get you in the OR pretty soon. And roughly 20% of appendectomies were performed on a misdiagnosis, up to 28% in women. So 28% of the time, they're removing appendices, and it's not the appendix that's the problem. It's easier to do in women because we have other organs in that area. We have ovaries, fallopian tubes, things like that can present as appendicitis. They think you have that, they go in and remove the appendix and find out that it's actually fine. All right, so to prevent appendicitis, you're going to want to eat a lot of fiber and do things that support your immune system, and of course exercise. I will go over why fiber is important. So dietary fiber is the indigestible portion of food derived from plants. It has two main components, soluble fiber and insoluble fiber. So the reason fiber is important to prevent appendicitis is because fiber softens your stool and increases its weight and size, making it easier to pass. This means that the feces is less likely to become trapped in the appendix. So I think of it like a snowball. So if you start with a little bit of snowball and you keep rolling it, it's going to get bigger and bigger, and it's going to drive the snow out. And in a way, fiber functions to really help clean your intestines out. So you'll be less likely to have it trapped in the appendix and cause inflammation or infection. So here are the best sources of fiber. Avocado, Asian pears, berries, coconut figs, artichokes, peas, okra, acorn, squash, Brussels sprouts, turnips, black beans, chickpeas, lima beans, split peas, lentils, nuts, flax seeds, chia seeds, and quinoa. I Googled fiber just to get a good list of the things that you can eat that have fiber, and Metamucil came up. That's not what I'm talking about. I want you to get your fiber from food and good sources, and that's really going to help prevent appendicitis. So, we went over how many people have had their appendix removed. So if you've had your appendix removed, now what? Since we mentioned that it's kind of the safe house for your good bacteria in your gut, it's really important to stay on a probiotic so you are constantly replenishing your gut with that good flora. Like it says, 80% of your immune system resides in your gut. So it would be definitely important to stay on a probiotic. And you can also do things that help support your immune system as well. We recommend vitamin D. There's also Lycos C that Red Bar has. All right, this is long, but it's a really good explanation of what the gallbladder does. And I'm just going to read it, and then kind of we'll go from there. The main purpose of the gallbladder is to store bile needed for the digestion of food. The gallbladder is part of the biliary system and serves as a reservoir for bile, which is produced by the liver. The liver produces the bile, which then flows through the hepatic ducts into the gallbladder. At any one time, about 1 to 2 ounces of bile is stored within the gallbladder, so it can be as large as a small pear. When food containing fats enter the digestive tract, it stimulates the secretion of CCK from one cells of the duodenum and jejunum in response to cholecytokinin. The gallbladder rhythmically contracts and releases its contents into the common bile duct, eventually draining into the duodenum. The bile emulsifies fats in partly digested food, thereby assisting their absorption. Bile consists primarily of water and bile salts and also acts as a means of eliminating bilirubin, a product of hemoglobin metabolism in the body. So all of that just to say that when you eat fats, your body knows that you're eating fats, so it's going to stimulate that secretion of the bile salts to help you digest and absorb those fats. The bile that's secreted by the liver and stored in the gallbladder is not the same as the bile that is secreted by the gallbladder. During gallbladder, storage of bile is concentrated by removal of some water and electrolytes. This is through the active transport of sodium ions across the epithelia of the gallbladder, which creates an osmotic pressure that also causes water and other electrolytes, such as chloride, to be reabsorbed. So basically, all of that to say that as the bile is sitting in the gallbladder, it's concentrating, it's getting more potent. So when you don't have a gallbladder and you're constantly trickling that bile into your intestine, it's not as concentrated as if you had a gallbladder where it would be sitting there and concentrating. All right, so the gallbladder is located under your liver. So if you take your fingers and dig your hand under the right side of your ribs, that's where your gallbladder is. So in short, the gallbladder releases concentrated bile into the intestine after a meal, aids in digestion of fats. It's explained like oil and dish soap. So if you take an oil, the best way to dissolve it is to emulsify it, and you do that with the soap substance. It helps to neutralize the stomach acids to prevent damage to intestinal lining. So it also is releasing a substance to help neutralize the stomach acids coming out of your stomach. All right, so typically what you'll have with the gallbladder is it can be inflamed or infected, and it's caused usually by gallstones. Here's a picture. Here's a healthy gallbladder, and then you can have gallstones, and then the gallstones can actually block the duct. All right, so a little bit of epidemiology. Cholecystitis accounts for 3 to 10% of cases of abdominal pain worldwide. Cholecystitis caused an estimated 651,829 emergency department visits and 389,180 hospital admissions in the U.S. in 2012. The 2012 U.S. mortality rate was 0.7 per 100,000 people, so not as high as appendicitis. The frequency of cholecystitis is highest in people aged 50 through 69 years old. So we see the age goes up. Appendicitis is usually younger people. Cholecystitis is older people. Gallbladder problems are more common in women. Appendicitis we found was more common in men. Gallbladder issues are more common in women. All right, so if you have gallbladder problems, the signs and symptoms are going to be right upper quadrant pain. Like I showed you where the gallbladder was, you're going to have tenderness in there. A lot of times you'll have throwing up, and a lot of it, and it's not just once, you're going to be throwing up multiple times. You'll have what's called a positive Murphy sign. So I've had patients that I suspect gallbladder problems, and I'll have them lay on their back, and I'll basically dig my fingers, have them take a deep breath, let it out, and if you have pain or what's called reflex apnea, basically they stop breathing for a second because of the pain. That's called a positive Murphy sign. You can also have referred pain to the shoulder blade. So it may not be as tender here, but you could have that referred pain to the shoulder blade. So diagnosis is going to be by ultrasound, CT scan, and a clinical exam. Typically, the diagnosis is not as fast. Like I said, if you go into the emergency room with appendicitis type symptoms, they're going to usually take out your appendix before they go through the diagnostic procedures in full. With gallbladder, they usually will go ahead and do an ultrasound or a CT scan to confirm gallstones or cholecystitis. And then, like I said, there's different clinical exams you can do as well. All right, so treatment is going to be, usually if there's gallstones, they remove the gallbladder and all of the stones with it. Or I'm sure dietary changes would be important. I've had patients that don't necessarily have gallstones, but they have what's called like sludge or gallbladder problems, and they'll recommend limiting fats, etc., and they won't go straight to removing the gallbladder. So just a few complications from removing your gallbladder. A lot of times, and I've found this in research, and I've seen this clinically in my patients, you have weight gain after you have your gallbladder removed. You also have fat malabsorption. So if you don't have your gallbladder to store and concentrate the bile and release it all at once, like a gush when you have that fat digestion, then you're going to have fat malabsorption because you're not going to have that substance to emulsify the fats that you're eating. So this a lot of times will present as diarrhea or what's called steatorrhea. Steatorrhea is basically having fat in your stool. So if you're not digesting it, you're actually gonna just defecate it, and you'll see it in the when you go to the bathroom. Your fat will be, or your feces will be very shiny or floating. So you also could have damage to the intestines due to the bile salts and the stomach pH. I mentioned that the gallbladder, what releases from the gallbladder helps to neutralize the stomach acid. It also releases certain things that help protect the intestines from the bile salts as well. Also, I found in research that there could be an underlying hormonal issue that causes the gallstones, and if you just take the gallbladder out, it doesn't necessarily fix that underlying hormonal problem. And according to the research, it was estrogen imbalances, basically. You had too much estrogen. So to prevent gallstones or gallbladder problems, you want to lose weight slowly. You don't want to do a crash diet and lose 20 pounds in a short amount of time. You want to stay on track, but you want to lose weight slowly and healthily. You want to have good quality fats, avoid bad fats, exercise is important, Fiber, once again, is important, and avoid hormones or birth control. I did found in this study here that there was an increase in gallstones with people on hormonal birth control. All right, so got some fried chicken up there. When gallbladder disease is suspected or has been confirmed, it's critical to avoid fried foods. Fatty foods, in particular types of fats like trans fats, hydrogenated fats, partially hydrogenated fats, and saturated fats. And even if you don't have a gallbladder problem, these are not good for you. There's no reason to eat these unless you just want to splurge every now and then. But they're not healthy and they're not good. They're not good for your body or your gallbladder. So these are a couple of things that you can do to help relieve symptoms of gallstones or gall sludge, whatever you want to call it. We do have what's called the KGP flush. I have patients that don't have gallstones, and I'll recommend this. I don't have a protocol that if you do have confirmed gallstones that I'm going to help you with, because it's dangerous to try and flush gallstones by yourself. It can be. So this is before you have a problem. You can do a gallbladder flush. Beets are also really good for your gallbladder. There's a supplement standard process that is called AF beta food. We can special order it. It has beets in it. You will want to avoid fats. Even the healthy fats, you want to limit even the healthy fats while you're healing or while you're, or if you don't have a gallbladder at all. And then I read a little bit about apple cider vinegar and gallbladder health. All right, so you've had your gallbladder removed. Now what? You obviously can't get it back. So it is really important that you take an ox bile supplement so you can properly digest the fats. And like I said, that presents itself as steatorrhea or diarrhea, where basically every fat that you eat, you're expelling. The D is what we carry that has the ox bile salts in it, and it's going to help emulsify the fats that you are eating. So once you start taking a digestive supplement, you will want to replenish your omega-3 level, because likely you are deficient. If you don't have a gallbladder and you're on an omega-3, you're not really absorbing it, even if you're taking it every day. So you'll want to definitely look into replenishing that omega-3 level after you start getting on that digestive enzyme. Since gallbladder problems and thyroid problems are closely related, I would get on TMI as well, and we'll go over that a little bit more in just a second. All right, so this is not really an organ, but they're very commonly removed in children, the palatine tonsils. So these are the tonsils on either side. So they are immunocompetent tissues, and they are the immune system's first line of defense against ingested or inhaled foreign pathogens. So basically, you inhale something or you digest something, that's the body's first way of knowing what it's dealing with. So you can see through the processes that it goes through, it is basically signaling your body to start the immune response. So they definitely have a purpose, and they're there so your different cells that you need to fight off that antigen are going to start to be produced and released in your body. Y'all can read that if you want. All right, so tonsillitis is the most common thing we see with tonsils. It is usually viral, most often caused by the common cold viruses, and occasionally by Epstein-Barr virus, herpes simplex virus, cytomegalovirus, or HIV. And about 30% of the time, the cause is bacterial. But a lot of times you go to the doctor and you have a sore throat and they say you have tonsillitis, they give you antibiotic whether they really know or not. Hopefully they swab. If they swab, they can do a culture and see if it's viral or bacterial. But like it says, only about 30% of the time is the what's causing the tonsillitis bacterial. So tonsillitis symptoms. You can see here there's the normal tonsils, and then you have the inflamed tonsils. Pain with swallowing is the hallmark, and it's the hallmark sign, basically, of having tonsillitis. And it's also often referred to the ears. Very young children who are not able to complain of a sore throat often refuse to eat. They can have high fever, malaise, headache, and GI upset. You can also have swollen cervical lymph nodes that can be present as well as you're fighting off the virus or fighting off the bacteria. Those are the closest lymph nodes that are going to be helping you fight that off. It also says that basically bacterial and viral tonsillitis have a lot of the same symptoms. So epidemiology, sore throat accounts for about 2.1% of ambulatory visits in the U.S. Acute tonsillitis is more common in children between ages 5 and 15. The prevalence of bacterial tonsillitis, specifically group A beta hemolytic streptococci, is 15 to 30% of children with sore throat and 5 to 15% of adults with sore throat. Acute tonsillitis is most commonly seen in winter and early spring in temperate climates, although it may occur at any time of the year. So it's basically you get a cold and you get a sore throat with that, and that's usually tonsillitis. So if it's caused by group A streptococcus, it's called strep throat. So that's pretty common, especially in like the cold and the flu season. So the diagnosis is a throat exam and sometimes a swab to see if it's bacterial or viral. Treatment is antibiotics, or you treat the symptoms, and if the infection keeps coming back, especially strep infection, they will recommend the removal of tonsils. So what happens after a tonsillectomy? Research shows that immediately after surgery, there is a decrease in immune function. So basically they measured the levels of the IgG, the different antibodies in the blood after tonsillectomy. And it is decreased immediately after a tonsillectomy. But over the long term, it does usually recover. So your body finds other ways to get the immune response that it needs. But since the tonsils are basically the body's first signal that you're about to have to fight off a bacteria or a virus, the immune response, I'm sure, will take longer, since that's that first signal. But having your tonsils out is not as bad as having your appendix removed or a gallbladder out. It definitely isn't as bad, but they are important. They just serve a purpose. So avoiding tonsillitis or treating tonsillitis. So immune support is really important. I really like Super Virogon. I start taking this as soon as I start to feel a cold coming on, and usually it stops it right away. You can get a humidifier, a cool mist humidifier. In the winter, you can get a diffuser if you like essential oils. Silver solution can be gargled or sprayed in your nose to help run down your tonsils. And then you can also get what's that thing called? Yes, and you can get a nebulizer and put the silver solution in that. I didn't put that on there, but I'm trying to figure out that one.
Looks like Iron Man.
All right, so this is your adenoid or your pharyngeal tonsil. You only have one. The adenoids are a mass of soft tissue behind the nasal cavity. Like lymph nodes, adenoids are part of the immune system and are made of the same type of tissue, lymphoid tissue. White blood cells circulate through the adenoids and other lymphoid tissue, reacting to foreign invaders in the body. So you only have one, and here it is. And it's basically going to function the same as your palatine tonsils. It's going to signal your body to have an immune response. Adenoiditis is when the adenoid becomes inflamed or infected, and it can block the airway. It can also block eustachian tubes and cause sleep apnea. So this is a little bit can be kind of serious if you have an inflamed adenoid because it can block your path to breathing. So, and that's a lot of times why they end up having to take the adenoid out because it's so inflamed that the child's having a hard time to breathe or sleep. Ear infections, a lot of times, they can have conductive hearing loss and hyponasal voice quality. Chronic adenoiditis can also cause chronic or recurrent nasopharyngitis, rhinosinusitis, and epistaxis, halitosis, and cough. So it's basically going to present itself a little bit differently as tonsillitis. You may not have a sore throat, but you'll have a hard time breathing because of that swelling. So the diagnosis is going to be by x-ray. You can sometimes see an inflamed adenoid on x-ray, or by what's called flexible nasopharyngoscopy. I did not say that right. But basically they get a scope and they send it through your nose to look at your adenoid and see if it's inflamed. So if that inflammation persists, then they'll recommend that the adenoid be removed. And a lot of times when they put tubes in the ear, they'll also take adenoid out. And then as another form of treatment, they try to look at the cause and see what's going on, why the adenoid's inflamed, and they'll treat it based on that. It can be inflamed due to allergies. So DIE-NSECTED is really great for people that have patients that have allergies, and it's got a lot of great stuff in it to help that immune response. I do have an allergy workshop on YouTube that you can reference and learn more about how to naturally help your allergies. All right, so I didn't cover the thyroid in full because I did an entire workshop on the thyroid, and I go into detail the thyroid and how it works and how it functions. But I did want to cover it because it is a commonly removed organ, unfortunately. So I will go over briefly what it does. The thyroid is in charge of controlling hormones essential to your metabolism. The function of the thyroid gland is to take iodine found in many foods and convert it into thyroid hormone T4 and T3. Thyroid cells are the only cells in the body which can absorb iodine. So basically, it's the gland that's in your neck, and different things can go wrong with that. We can have hyperthyroidism, hypothyroidism, and thyroid cancer. There are other things that can go wrong with your thyroid, but these are the most common. And I talk about a lot of this in my thyroid workshop, like I said. So if you have underactive thyroid, that's going to be called hypothyroidism. You're going to have a low metabolic rate. You're going to feel cold. You're going to have a low energy, poor appetite, poor growth if you're a child, poor mental function, depressed, poor memory, inability to concentrate, sleepy. You can have a goiter, so basically that's when your thyroid enlarges and it'll be very present on your neck and you'll just really see it. If you have hyperthyroidism, that's going to be the other side where you're going to have overproduction of thyroid hormone. You're going to have a high metabolic rate. You're going to feel hot. You're going to have a high appetite, but you're losing weight. You're going to have excessive growth if you're a child and having this problem. You're going to have hyperactive and inability to sleep. So they're kind of opposite. There is a relationship between gallbladder health and thyroid function, and I mentioned if you have your gallbladder removed, we went through all the supplements to take, and I mentioned taking TMI, and this is why there is an association between gallstone disease and hypothyroidism. So it would be important to make sure you're getting enough iodine with that so your thyroid can function normally as well. So the treatment for usually hypothyroidism is going to be the artificial hormone Synthroid. It's one of the most prescribed drugs in our country. Let's see. If you're not on Synthroid, sometimes they'll remove the thyroid, some of it or all of it. So prevention, so the biggest thing about avoiding having to have your thyroid out or having to be on synthetic hormone is going to be making sure your body has all of the nutrition it needs for your thyroid to function. Iodine is going to be the most important because it's what the thyroid uses to make the thyroid hormone. And then there's also all of these, and I go over this in depth in my thyroid workshop, why your thyroid needs each one of these, and if your diet is deficient in it, there's no way your thyroid can function properly. All right, selenium, zinc, magnesium, B12, B2, vitamin C, vitamin D, vitamin A, and protein. All right, so with every other organ or gland, I kind of had probably better advice, but once your thyroid is out, there's not a whole lot you can do. You're basically on Synthroid, and you have to be on synthetic thyroid hormone for the rest of your life. But you can concentrate on keeping yourself healthy in other areas of your life. You can exercise, you can make sure you're eating good quality foods, you're eating good quality meats and dairy if you eat meat and dairy, and eating lots of vegetables and fruit. So you can make sure every area of your life is as healthy as possible. So, in summary, if you have yet to have an organ, gland, or tissue removed, it's really important to work proactively to maintain health in your body. It's not easy in the culture that we live in. We're constantly being bombarded by toxins and bad food. So it's really important to take that extra step and love yourself and care for yourself and make sure you're doing everything you can to promote health. Exercise is really important. Having a good diet. If your diet lacks, look into what supplements you might need to take to fill those holes. If you have had organs removed, make sure you take extra precaution to compensate for the loss. If you've had your gallbladder out, like I said, it's really important to take that oxide so you can absorb that. And then the appendix, you want to make sure you're on the probiotic. Everything we mentioned